Hello everyone, my name is Tim Hegdahl. I'm a paramedic with the Medford Fire Department, and in this video we're going to be taking a look at our local Jackson County protocols for mass casualty incident with a specific focus on the Care Flight Triage system as a means for initially sorting and prioritizing victims of a mass casualty incident. This diagram is a breakdown of the Care Flight Triage system and provides a step-by-step process for us to follow and criteria for us to use when we're sorting patients into the categories we've already been familiar with from the past, with a green patient being a delayed patient, yellow patients being urgent, the red patients being immediate, and the black patients being expectant or deceased. As we approach an MCI scene as providers, the first step for us would be to determine the walking wounded, which we will ultimately label green. So anybody who can stand up and walk, we would have moved to a designated area to either be triaged by additional personnel, or they are the patients that you will circle back to once you've prioritized the yellows and the reds of the patients that remain. Once those patients have been moved to a designated area, the remaining patients that are on the ground will utilize a systematic process that we apply patient to patient to determine their severity level and to treat any immediate life threats. So as we approach each individual patient, we first need to assess whether or not we see any immediate life threats, any large amounts of bleeding coming from the patient, any open chest wounds, and then assess rapidly for the need for any chest seals and or needle decompression. Ideally, each individual patient assessment and treatment should take no longer than 60 seconds so that we can maximize efficiency and cover all of the patients that need to be triaged in a given area. Once we've addressed any of those immediate life threats, we determine whether or not the patient can obey commands. And it can be a simple command like squeeze my hand, something that is easy to follow and you can use rapidly to determine whether or not they're tracking with you. If they obey commands, then we would feel for a radial pulse. If they do have a radial pulse that we can palpate, that patient is a yellow patient, and we will mark them as such. If they don't have a radial pulse, then they are marked as a red patient. If we had asked them that question to squeeze our hand and they were unable to do that, if the patient's breathing, then we would classify them as red. If they aren't breathing, then we will take steps to open their airway either manually or by placing an adjunct. And if they don't then spontaneously begin to breathe with their airway open, they would be labeled a black patient. With the Care Flight Triage system, we have a couple of different options for labeling our patients once they've been triaged that are listed in the protocols. First option we have is to use colored ribbon or flagging with colors that correspond with the category of patient that we've triaged. So if we label the patient as yellow, we would tear off a piece of yellow flagging, tie it around a limb or somewhere that is easily visible to other responders. And it's also important to remember to try to take a small piece of flagging as you go patient to patient and put it in your pocket so that once you've finished triaging a group of patients, you should have the same number and color of pieces of flagging that correspond to the patients that you've triaged. If you don't have the flagging, then we can also use ink markers. We can use colored ink to label a patient in each particular category. Or if we have just a black ink marker, we would write the words immediate/red, for example, on a patient's limb. The preferred location is the left arm if it's uninjured and available for us to use to label. Otherwise, use something, again, that would be easy to spot for other responders. So to summarize that initial triage for us as we approach a group of patients, a patient who can walk would be labeled green or delayed. Then patient by patient, going one at a time systematically, we will assess for the need for life-saving interventions. So we control major bleeding with use of tourniquets. We would open patients' airways. We would use chest seals and needle decompress for those needs, and then label patients as yellow, red, or black. So a yellow patient would be a patient who cannot walk, but they can obey commands and they do have a radial pulse present. An immediate patient would be a patient who cannot walk. They have to be breathing spontaneously. They cannot obey commands, or if they do obey commands, they don't have a radial pulse. And then an expectant or black patient would be a patient who is not breathing spontaneously after we've opened their airway. In this video, Squad 13 paramedic Mike Rust will demonstrate the implementation of some of these Care Flight principles for rapid triage of a group of victims of an MCI. This would be for the remaining patients on the ground once all of the green patients have been able to get up and walk to a designated location. As Mike arrives at his first patient, he makes verbal contact. He can tell that the patient is breathing, but they're semi-conscious, so they're not tracking with what he's saying. He also notices a large pool of blood growing beneath the patient's left arm. So he begins applying a tourniquet for life-saving intervention for that major bleeding. This would be that part in our triage process where we would also determine any open chest wounds that need chest seals or the need for needle decompression. Since the patient is breathing spontaneously but not following commands, this patient would be classified as a red patient under this system. So once Mike finishes addressing the major bleeding and performing that intervention of applying the tourniquet, he'll grab a piece of red flagging from his belt. He'll take that flagging and he will tie it around the patient's left limb to classify them as a red patient. And then he'll remove a small piece of that red flagging and place it in his pocket corresponding with that patient he's triaged before moving on to his next victim. As Mike approaches the next victim, who in this case happens to be played by EMT Tyler Barrett, the victim appears very upset and is pleading for help. Mike does a quick check as he walks up to make sure there's no obvious life threats like major bleeding, makes verbal contact with the patient, and asks him where he's hurt. The patient indicates he can't walk. Mike does a quick assessment to determine whether or not he can follow commands by asking him to squeeze his hand, and he can do that. He also does a quick radial pulse check and finds a strong radial pulse. So therefore, with the patient being able to follow commands, having a pulse present but unable to walk, they're a yellow patient. Mike applies the yellow flagging to the patient's left arm, takes a small piece to put in his pocket, moves on to the next patient. The victim might beg and plead for us to remain with them, but we should try and limit our time to 30 to 60 seconds in order to rapidly triage all victims efficiently. Mike approaches the next victim, who is unconscious and is not breathing. He kneels beside the patient and does a quick radial pulse check and doesn't palpate any radial pulse. He then manually opens the patient's airway. After opening the airway, the patient doesn't appear to be breathing spontaneously. With this, the patient would then be labeled black, so Mike removes black flagging and ties it around the patient's left arm, retaining a small piece in his pocket. If able, the patient's arms and legs should be folded across their body to indicate to other responders that the patient has already been triaged. Again, at this point, Mike would revisit and label the green patients if other responders aren't available to perform that task. As we complete triage, coordination would then take place to move all patients to the treatment area and then on to transport as we progress through the MCI event. And so to summarize, this has been a short video review of the Care Flight Triage system for use in responding to a mass casualty incident. And by being systematic, quick, and efficient, we can meet the objective of doing the most good for the most people. Hope this helps, and thanks for watching. Go for it.
Sir, can you hear me?